Catherine, you ready?
Yes, I'm good.
Take it away, Dr. Wesson.
Thank you, Catherine. Welcome to the 9th Annual Dallas Hunger Summit, entitled From Hunger to Health. Food justice does not mean just us. Thank you all for attending. Please type your name, organization, and email into the chat box so we know who's joining us. You'll also be eligible for a drawing at the end of our webinar today. More about that later. I am Dr. Donald Wesson. I most recently served as president of the Baylor Scott & White Health and Wellness Center at the Juanita J. Craft Recreation Center here in Dallas, Texas. In that role, I was and remain an advocate for improving the health of communities through focused, data-driven population health initiatives. Currently, I am professor of medicine at Texas A&M College of Medicine and the principal with the DEW Consulting LLC Corporation and a member of the leadership team of the Dallas Coalition for Hunger Solutions. In 2011, Congresswoman Eddie Bernice Johnson and multiple public and private entities came together to inform the public and concerned leaders about the problem of hunger and food insecurity at the first Hunger Summit in Dallas. Since then, over 250 organizations and individuals have come together as the Dallas Coalition for Hunger Solutions to develop objectives and implement action steps to reduce food insecurity and promote equitable access to healthy, nourishing food for their neighbors. The Dallas Coalition for Hunger Solutions, chaired by Congresswoman Johnson and guided by a leadership team, has continued to hold the Dallas Hunger Summit annually. Today's event is the fourth and final in a series of 4 Hunger Summit webinars on food justice. The mission of the coalition is to empower all Dallas County residents to gain equitable access to healthy food. The strategy is to create and sustain action teams that focus on priority areas: child hunger, senior hunger, faith community hunger solutions, public policy, and urban agriculture to reduce food insecurity through collective impact. Access to healthy food is such an important issue for our youth, families, and older adults. We know that too many of our neighbors are struggling with having enough nutritious food to eat. We also know that access and having a good nutritious diet helps keep us healthy, and that lack of access and having good nutritious diet helps to contribute to disease and the health disparities. Through the 3 previous webinars in this series, we have explored the concept of food justice, what it is, why it's important, and how to create it, and what it would look like in Dallas. We also learned about the public food and nutrition policies helping so many families during COVID-19 that need our support to continue after the pandemic, because they are effective tools for building food health equity. Today, we continue to examine the critical connections between hunger, nutrition, and health through a justice lens. With the help of a national expert and local practitioners, we will be challenged and inspired to do all that we can to level the field and create communities that are more equitable with access to proper nutrition and optimal health for all. At the end of our webinar today, we will give away 5 $25 Amazon e-gift cards. In order to be eligible for a gift card, you must have attended all 4 webinars. Winners will be announced after we return from our breakout sessions around 11:45. You must return to the main meeting after the breakouts to be eligible to win. I want to let you know that we are recording today's presentation and that everyone will receive a link to the recording and a copy of the slides in a follow-up email in the next few days. At this time, I'd like to acknowledge Congresswoman Eddie Bernice Johnson, who is in her 13th term in Congress representing the 30th Congressional District of Texas. She was instrumental in launching the coalition, and as coalition chair, her support has made the coalition's accomplishments to date possible. Let's listen to what she has to say to us this morning.
Good morning, and thank you for tuning in to the 4th and final webinar of the 9th Annual Dallas Hunger Summit, hosted by the Dallas Coalition for Hunger Solutions. Over the past 4 weeks, we have had the opportunity to hear from local leaders and experts in the food justice movement about what food justice is, how it affects and creates other issues in communities, what is being done on the policy side, and the next steps needed to create a solution. But today, it's not just about listening. Today is the day that I hope you start taking action. Many of the organizations that make up the Dallas Coalition for Hunger Solutions are always ready to work with leaders from around the community to solve our problems at a grassroots level. Please do not hesitate to reach out and get involved so that we can work together to find an equitable solution to the hunger crisis. Also keep in mind that great policy proposals may not make it through the Congress or the Texas State Legislature if it falls on the wrong ears. That is why you must exercise your right to vote on November the 3rd. You must also be sure to respond to the 2020 census to ensure that vital public service programs and facilities in our community remain open and accessible. I want to thank each and every one of you who attended these sessions over the past several weeks. It is because of people like you committed to building a healthier and more equitable North Texas that I am optimistic about our future. Good morning, and thank you for tuning.
So thank you, Congresswoman Johnson, and thank you for your ongoing support over the years and your leadership that has helped to make this initiative possible and for its success thus far. It is encouraging to be with all of the many organizations and community leaders joining us online today as we learn about this issue of food justice and what it would look like in Dallas. A number of organizations have stepped up to provide financial backing to make this event possible. Thank you to our 2020 sponsors, the Dallas Baptist Association, the National Council of Jewish Women of Greater Dallas, North Texas Food Bank, United Way of Metropolitan Dallas, and the Episcopal Diocese of Dallas. Your continued partnership for this event makes it possible for us to educate, equip, and energize allies to advance food equity and security for all of our neighbors. Well, now it's my pleasure to introduce the highlight of our program, our featured discussant, Dr. Seema Yasmin. She will help us in activating Dallas for food justice. Seema is an Emmy award-winning journalist, poet, medical doctor, and author. Dr. Yasmin served as an officer in the Epidemic Intelligence Service at the U.S. Centers for Disease Control and Prevention, where she investigated disease outbreaks and was principal investigator on a number of CDC studies. She was a finalist for the Pulitzer Prize in 2017 with a team from the Dallas Morning News and recipient of an Emmy for her reporting on neglected diseases. She has provided her expertise as a medical analyst for CNN and as a professor of public health at the University of Texas at Dallas. Dr. Yasmin, who has unique experience in medicine, epidemics, and journalism, currently directs the Stanford University Health Communications Initiative. I invite the audience to enter any questions that might come to you during our conversation into the Q&A box. We will have an answer as many of them as time allows. So welcome to the Dallas Hunger Summit, Dr. Yasmin, and thank you for joining me.
Thank you, Don. I'm really happy to be here. Thank you for including me in this conversation about food justice and science communication.
Well, it really is my pleasure personally and our pleasure collectively to have you. And I have to tell you, Dr. Yasmin, I had the opportunity to review many of your work and your publications over the last month or so. And first of all, it's not only an impressive body of work, and thank you for what you've contributed to this issue, but a common theme that came to me was the importance of effective science and health communication. So if my assessment of your body of work is correct, why are you so passionate about effective science and health communication?
So I didn't used to be. I went to medical school, I did my residency and fellowship thinking this is what doctors do, right? And I was very interested in seeing patients, but also in epidemics and things that affected whole populations. It's while I was doing that, it's while I was a disease detective at the CDC that I thought, wait a minute, we're not doing our jobs fully and effectively if we're not communicating what we're doing as well. And I kind of had this aha moment when I was going to one hot zone after another, dealing with one epidemic after another, where my bosses back in Atlanta would say to me, you need to focus on whatever epidemic is spreading. Your job is to stop the contagion. So every time I was dealing with an epidemic, my singular focus would be whatever virus it was that was spreading, whatever bacteria, whatever fungus. But I saw myself firsthand that whenever I was in a place where a disease was spreading, it was not just a pathogen that was spreading. There were rumors, there were medical myths, there were health hoaxes, and they spread in tandem with the pathogen, but they also fueled the spread of the epidemic. So it was really important that we addressed the spread of information as well and didn't just keep our eye on the pathogen. And I felt public health was too focused on just the one part of this and not looking collectively, holistically at how our health, our bodies, our environments are affected, not just by the diseases that spread, but the information that spreads as well. So I thought this seems a little short-sighted. I think I need to learn a lot more about communication. For example, as a public health physician, I could speak to you for hours about how amazing vaccines are, how vaccines have saved so many tens of millions of lives over the past few decades, but actually the anti-vaccine groups and those anti-science movements that are growing, they are better at communicating their messages, their anti-vaccine messages, than we are at communicating the good that vaccines do, which is how we end up in this situation. I used to write a lot about this at the Dallas Morning News, of epidemics of diseases we should be able to prevent now, measles, whooping cough, mumps. but that keep hitting us hard because in public health, we're not doing a good job of communication. So I really just came to this point, Don, where I was like, it's not enough for me to just have my public health doctor, disease detective hat on. I need to learn communication. And so I went to journalism school thinking, I don't know, this is a weird thing to do in my career, but I have to like follow my heart. I want to learn more about this. You could not have convinced me when I graduated med school that I would ever go back to any kind of school. But that's how urgent I thought it was, that we learn how to tell stories, learn how to communicate effectively. So I went to journalism school, got hired by the Dallas Morning News straight out of journalism school, and moved to Texas for about 3 years, which I had never anticipated. But I'll give you a quick, very recent anecdote as to why I think this is really important, and it's food related. So you may recall, I think it was about 5 or 6 days ago, that the CEO and founder of Whole Foods said something really, really ignorant. The CEO and founder of Whole Foods is called John Mackey, and he made this statement about how obesity is really caused by poverty and ignorance. It's not about food choices. It's about poor people who just don't know like what they should be eating. Sorry, he was saying it is about food choices, not about access to food. There was so much ignorance wrapped up in his comments, so much elitism, so much not understanding the realities of what it takes to get access to healthy, nutritious food for many tens of millions of Americans. And I think on our side, we have to do a lot of work to then debunk what he said, because otherwise people believe that. They think obesity is just because you make silly decisions about what you put in your body. In the chat, I will share a link to a Dallas Morning News story I wrote in September of 2016, which followed these two kids, a 10-year-old and an 11-year-old, who lived in Fraser Courts in South Dallas, who lived in a zip code with really high rates of obesity and diabetes. We know that in Dallas, your chance of having diabetes is about like 1 in 9, but actually in that neighborhood, the chance of dying from diabetes is 3 times higher than for Dallas overall. Nothing about this is equal. And this is a story that I think is a good example of the kind of work we need to do to show, let me take you into South Dallas. Let me introduce you to a mother who has 2 kids, who works nonstop, but is doing everything she can to enroll her kids in, it was a Baylor program for a kids triathlon. She was trying to get her kids to eat healthy. She was doing everything she could to get her 2 young kids to exercise. But by following them for a few days and writing their story, you can see that for them, the easiest place to go grab a snack is a gas station. So, you know, you hang out with them for a few days and you're like, that's what the CEO of Whole Foods needs to do, is hang out in Fraser Courts for a few days with parents who are so motivated to keep their kids healthy, but are up against 10,000 obstacles, it feels like sometimes, in terms of doing that. So in a nutshell, that's why I am really passionate about science communication and health communication. And Don, that's why I think we can't just be in our circles as physicians and healthcare professionals writing in journals and writing for our communities. We have to be communicating the science and the health information to everyone, because there's so much nonsense circulating out there as well.
You know, Seema, it's really impressive certainly as a physician, to listen to you, because we were trained as physicians to communicate one-on-one with our patients. But I don't know about you, but I wasn't trained to be able to communicate with the public at large. But you're telling us how important that is, not just for us healthcare professionals, but for everyone to be able to communicate good, accurate health information to the public overall.
Absolutely. And I think if we're not trained to do that, and if we're not doing it, then we leave a gap. And then people who are spouting all kinds of non-scientifically based messages, they take that platform. So some of the work that I do now, Don, is training healthcare providers to say, here are some of the skills that can really enhance your communication. Yes, one-on-one with patients, but here's how you can take those same skills, those same techniques, to be able to translate something technical, something really medical, to a broad audience, so that the information is coming from a credible source. And it's quite heartening when I look at the data of these surveys where the public is asked, who do you trust most when it comes to health information? Because you might think, oh, it's going to be Gwyneth Paltrow, it's going to be these celebrities who a lot of of them are anti-vaccine. You know, Gwyneth Paltrow sells all kinds of things on her website that are supposed to be like for wellness that are actually potentially dangerous in some cases. But when you look at these surveys, it comes back to the public saying, no, I trust my doctor. So we need to make sure that we are giving doctors and nurse practitioners and physician assistants and everyone in the healthcare field those tools where you can really effectively communicate and give people all the information that they need in order to make informed and good decisions about their lives.
Thanks, Seema. So you've mentioned the word health, and you also said public health. So when most of us hear the term health, we typically think of it as something that is being delivered to us by our healthcare professionals, our nurses and physicians. But I see you've written a lot about, and you've talked a lot about right now, about public health. So can you help us understand what is public health and how it relates to, or might not relate to, the type of health that we commonly receive from our healthcare professionals?
Yeah, so it's very connected, but a public health approach might be, for example, say you are feeling sick, you're running a fever, you go to your doctor and it turns out you have flu, you will hopefully get medicine or get advice about how to take care of yourself. That's kind of thinking about the patient as an individual. And then if the person taking care of you wants to take it further than that, they might ask about who you've been exposed to or who you have exposed, who's taking care of you, and thinking about how that infection might spread from one person to another. But public health and population health is more than epidemics. It is more than that kind of obvious sense of it. Public health is when one disease spreads from one person to another, and you get a pandemic like what we're living through. Public health is also gun violence. That's a public health issue. Public health is also intimate partner violence and domestic violence. These things that we think of as being intimate, as happening in the bedroom or happening at home, those are still parts of public health. So when I was at the Dallas Morning News, we of course covered the horrible downtown Dallas shooting, the mass shooting, but we covered it, I especially covered it as a public health problem. Racism is a public health issue. So there's interconnectedness, but there are definitely these issues which affect all of us and affect us on a population level that are public health. But I'm really glad you asked that question, because otherwise it can feel really obvious to be like, well, public health is epidemics, it's infectious diseases. And in fact, in the world of public health, we're trying to be really careful to say it's also chronic disease. It's also the fact that most of us, you know, will die from cardiovascular disease, from stroke, from heart failure. Those are public health issues too. And in terms of what you mentioned, I think you mentioned earlier in your question, this idea about, at least I interpreted it as like that trickle down of information from the top to the bottom, like from what providers tell you, and then we should just be like passive recipients of that information. I am really against that. And I kind of went into medicine to try and dismantle that a bit from the inside, because I don't think it works. Maybe it used to work in a bygone era, I don't know, even then. But I think now this idea that we can just be like, I am the physician, I am the expert, I have evidence, and I'm just going to give you evidence and you're going to do what I tell you. It doesn't fully work like that. Yes, we can get patients to have a relationship with us, to trust us, but people are exposed to their family group chat on WhatsApp. People are looking at misinformation and disinformation spreading on Facebook and Twitter, and LinkedIn, Pinterest even, right? There's a lot of anti-vaccine messaging on Pinterest, for example. So I think we need to have a much more level playing field when it comes to that communication. And that means that we need to do a lot more listening of patients and listening of communities, and also collaborating. So it's not just this top-down effect of, we know what you need, we're going to tell you what you need. We need to be going to Fraser Courts. We need to be talking to those parents who are really motivated to keep their kids safe, but are having to get them snacks from the gas station because that's what's in the neighborhood.
Well, I'm glad you mentioned Fraser Courts. I know them very well. But it's interesting. Public health is now in the news a lot when in the midst of this COVID-19 epidemic. But I think I'm hearing you say that we should be communicating about public health in between epidemics. Is that something that's ongoing?
Oh, it has to be, because I think that's why we're in this crisis point right now when it comes to communication. We're in a pandemic, so we need to give people life-saving information about masks, about hydroxychloroquine is not a cure for COVID-19. We're having to do all of that in the moment, which is absolutely correct, right? We're all living through this crisis. It's a new virus, new information evolving all the time. But at the same exact time, we're having to play catch up in terms of trying to get the public to be scientifically literate. And that's work that should have been ongoing for decades. That's work that should really start in school. Because what's happening, Don, is I think science gets miscommunicated as science is a textbook. Science is a bunch of static facts. And when people fall into that trap and that misconception, you end up in a situation where the public is saying, well, scientists in March said you don't have to wear a mask. So now they're telling us that we should wear a mask. That's confusing. Should I even trust them? And do they even know what they're talking about? Because why have they changed their mind? As opposed to an understanding that science is not a bunch of static facts. Science is a process. It's an evolving process. It's one where we ask questions, we generate hypotheses, and then we test them. And if we're good ethical scientists, it means we're willing to say, oh, I said, you don't have to wear a mask in March, but that was based on the evidence then. Since then, there's been so much evidence that masks make a really big difference when it comes to COVID-19 and everyone should wear one. If we had helped the public be more scientifically literate, and that's on us, not on the public, then I think we wouldn't have had that as much confusion, and we wouldn't have had people losing trust and faith in scientists, thinking they don't know what they're talking about. So I think it's an ongoing process.
Very good point. So we've been talking about the lack of access to food, certainly the quantity of food in our Hunger Summit up until now. Now, for those of us who are fortunate enough to have consistent access to food and therefore don't experience hunger, the quality of our food intake can become a health issue and or a public health issue. So can you help us make the connection between food intake and health as well as public health?
For sure. So all of these are interconnected. I almost think of them kind of like a Venn diagram or as like circles that sit within other circles. I think one thing to admit up front is that medicine and medical school really underplays the value of nutrition, so that most of us leave medical school with inadequate information and knowledge about nutrition. I think that shocks people, but I think we have to be honest about also how the nutrition science field is evolving, because so much of the kind of things that we grew up with thinking about nutrition have then turned out to be proven inaccurate and incorrect. So I think it's a good starting point to say that we have diminished this field in medicine. I would say that we are also playing catch up with this as a field. And then I think it comes down a lot to equity, to access, how, again, that example of Fraser Courts in South Dallas, that there are so many zip codes in the Dallas area, in Texas, across the country, that are certified by the USDA as being food deserts. So then if people basically defined, I think the audience knows this, but an area where it's really hard to get good access to fresh vegetables and fruit and whole grains. I remember doing outbreak investigations on the Navajo Nation and the Apache Nation, and there'd be a Wendy's, a Dairy Queen, and a McDonald's, but I would feel like I was going weeks without eating vegetables because they weren't of easy access on the reservation. And that's a place that I was, staying in for a month or so, but people spent their entire lives there without that. And so that's why I talk about access to food and access to nutritious food. It is a public health problem, but I don't always feel like doctors are well placed to have those conversations, because I've been having to play catch up since medical school, because I don't think the curriculum really gave it the space that it needed. I'm learning that's changing more now, thankfully, and there are some doctors really taking the lead on that.
Well, Seema, I'm embarrassed to say, I certainly went to medical school before you did. I received no nutrition training
The bit that I got really, it probably was a few hours on the curriculum, but then those points in medical school in your 3rd and 4th years where you all take elective projects, and then you come back and you kind of present to your peers about what it is that you went and studied away for 2 weeks. I did prison medicine, but one of my colleagues did nutrition. And it was just because she had picked that a lot of us got to learn a little snapshot of nutrition. And one of the things that she said to me, and this was in the UK, but it was something like 40% of inpatients in British hospitals were malnourished. And I was like, wait, what? So like we're on the wards with people who we're having real issues with wound closure, post-surgery. We're having real problems with treating their infections, but we're not dealing with this really basic thing of making sure that they are receiving the right macronutrients and micronutrients that probably would help wound closure, right? If their protein levels were high enough, for example. So it's woefully lacking in medical education. I'll have to do some digging to see if it's the same in nursing and PA education as well. But I'm glad it's changing a bit, but it still comes down to this idea that a lot of what we learned about nutrition, about filling up most of your plate with starches and things, for example, is bunk. And we're also learning about how there was big sugar was like paid off back in the day, with academics paid off by big sugar to make fat be the devil and the demon of nutrition, when really it's sugar and refined carbohydrates that have been a really big issue.
Absolutely. So as a kidney doctor, nutrition plays a big role in the patients that I see and take care of. As I said, I learned nothing about nutrition in medical school, and I had to learn it from the people with whom I worked, most notably dietitians. And so for me, the dietitians became my heroes. How have you interacted with dietitians in the course of your career?
Also, in similar ways, in terms of like with patient care, calling them in when you're realizing that it's not just about the food choices that that person is making, but we need to develop some strategies to improve that access to good food and nutritious food, help them make some good decisions. So it's been that, but also in public health. One of the first investigations I helped with at the CDC when I was in the Epidemic Intelligence Service was nothing to do with contagion. It was actually visiting some national parks in the southwest of the United States to look at what food choices were available for the public. And it was a lot of vending machines and a lot of snacks. And so then working with dietitians to understand, how do we change that? How do we make sure that as a federal agency, the CDC where I was at the time, how do we make it easier for people to make good decisions? I think there's always this thing that people make bad decisions, but it's like, if you gave people 3 really bad options, how are you going to judge them for picking one of those bad options? Which brings me back to kind of what John Mackey said, the CEO and founder of Whole Foods. It's a lot more complicated than he made it out to be.
Yes, absolutely. So we recognize that there's a struggle with both the quantity and the quality of food that we need to take in order to maintain the health. And the COVID pandemic has made this worse, and so it's brought it more to the forefront. But in the long term, we need to communicate better with our community about the importance of quantity and quality, that is nutritious food. So with your experience, can you give us some guidance as to how we can communicate the importance of this issue to our community overall in the Dallas-Fort Worth area?
Okay, so you might be shocked at this, but I take some of my health and science communication strategies from the playbooks of the anti-vaccine groups, because they are really effective. They are really good at getting their message across. They're better than we are. I'll give you one really, really quick example of this before I directly answer your question. So a couple of years ago in the Minneapolis area, there was a really bad outbreak of measles. And in fact, it hit Minnesota hard, and it was Minnesota's worst measles epidemic in more than 3 decades. And it was very much focused in the Somali American community in the Minneapolis area. And you would think, but why? Because that community actually had higher MMR vaccination rates compared to white Minnesotans. So you're like, wait, what's going on? But it turns out that about a decade ago, there were parents in the Somali American community there who were thinking that it seemed to them that there were higher rates of autism amongst Somali children. They were just seeing this anecdotally. They were really worried about it, as you would be as a parent. And so they went to the public health authorities, and the public health authorities did what good scientists do, which is, we take this really seriously. We're going to study it. We're going to see, is there really a higher prevalence of autism amongst Somali kids compared to like white kids in the Minneapolis area? And so the scientists went away to do their work, which, as you know, takes a minute. You can't rush that kind of science. You have to do your analysis really, really well. In the meantime, these anti-vaccine groups across the country, including in Texas, heard about these concerns. So they really had their ear to the ground, lesson number 1, about what was happening in Minnesota. Even Andrew Wakefield, who I believe was in Austin at the time, flew to Minnesota, and so did some of these other groups. They held closed door town hall meetings specifically for the Somali community in Minneapolis. They had armed guards at the door some of the times so that journalists, doctors, scientists couldn't get in. And what they did was when they had these town halls, they listened to the Somali American parents. They heard them say, we think autism rates are higher. We're really worried about this. And what they did was gave them a message that really fed into that fear. They said, you are right. Autism rates are higher amongst your kids. Autism rates are higher in your community. And it's because you vaccinate so much. It's because your MMR vaccination rates are higher than the general population. Over the course of the next years, the vaccination rates of MMR in that Somali community went from about 92% to about 40%.
Wow.
Dropped drastically because that communication they had received was so specific to their concerns, was so specific to what was keeping them up at night, and it answered a question. In the meantime, the scientists and the public health authorities came back and said, we did the analysis. We've done a really thorough epidemiologic study about autism and about developmental delay broadly. And you know what? It might appear that way to you, but actually the rates are similar. There's no higher rate of autism amongst Somali kids. Too late by then. But also what we do in science, and there's no easy way around this, I don't think, is we'll say, well, MMR does not cause autism because that's the truth, but we haven't got an answer to, well, what does cause autism? And those coming in with the anti-science message saying, well, we know, and we're saying it with certainty, the doctors are lying to you. We know the vaccines cause autism, which they don't. So what can we learn from this horrible, oh God, it was so heartbreaking. I remember reading one story about one of the mothers in Minneapolis who had two kids, I think both landed in hospital because they got, measles is a very serious disease, especially in young kids. And she was reflecting on the fact that she herself had lost a sibling to measles back in a refugee camp in the Horn of Africa. And she was saying, I didn't think this would happen to us here. It was just a really heartbreaking epidemic, as they always are. So what we can learn from this is we need to have our ear to the ground. We need to work with communities to really understand what their knowledge level is, what it is that they are seeking, and what it is that concerns them, what motivates them, because fear and anxiety are not nice, but they can motivate us to start working out and start eating well. The other thing is, the way that we do this in public health is, for example, a few years ago, there was a really bad, I think it was measles outbreak in Eastern Europe. And the World Health Organization tweeted something that really got under my skin. They tweeted something like, worst measles epidemic in Eastern Europe for decades currently happening, but don't worry, the World Health Organization is disseminating pamphlets. I'm like, okay, well, that sounds really great. In the meantime, we see what the other side is doing, which is flying in, holding town halls, listening, understanding what the concerns are, and then very specifically crafting a message that meets those concerns, that very specifically speaks to a community and treats this community here as different to this community here, because we all have different lives, we all have different histories, we all have different cultural contexts. But in public health, we do the one pamphlet for everyone, not understanding that a set of facts, a set of what we think is really good evidence, deconstructed into bullet points, is not going to trigger behavior in the same way as a video on YouTube that circulates with a mother who's like, look, I vaccinated my toddler and ever since then she's regressed and now she doesn't even speak in full sentences. That is so emotional. It really pulls at your heartstrings. It's anecdotal, but actually as a journalist and an epidemiologist, I can tell you, the epidemiologist in me is always looking at big data sets that connecting dots. But the journalist in me knows that the story about obesity in Dallas, it needs to have a couple of stats in it, but it needs to start off with that family in Fraser Courts, because otherwise you're not going to really relate to it. You're not really going to understand what that 1 in 9, 3 times higher risk of death means unless I take you into a home in South Dallas to introduce you to Morgan and her brother and her mum, and the fact that their grandmother and aunt live in that same home, and that both of them have diabetes and the kids are at risk of obesity. The stats don't help you understand that or picture that unless we're looking at real people's lives. The anti-vaccine groups, the anti-science groups do it so well. And so people sometimes get shocked because they do so much damage. And then I say, no, but we need to learn from them because they're so much more effective.
Wow, that's sobering, Seema. Particularly when we talk about health misinformation. And you already gave us what I think you were making the point about what food health misinformation that we heard from the CEO of Whole Foods.
Mhm.
So using your experience with the vaccine story that you just gave, how might we take this misinformation that we've just heard
Yeah.
about food from the CEO of Whole Foods? How might we now use that experience to better and effectively communicate accurate information to the communities that we serve? And I'm thinking of the family in Fraser Court.
Right. So as frustrating as it is that he said what he said, it made the news, and therefore it's an opportunity to educate, and it's an opportunity to have those conversations, right? Sometimes that's just how it goes. I say educate, but I want us to have really like the utmost humility when we think about this, because I think we really have to collaborate with communities. Instead of going to that mother in Fraser Courts and going to her neighbors in that community and being like, you need to make sure your kids don't eat these snacks, and they do. She knows that. Another mother may not, right? This mother worked in a medical setting, in fact. But you have to start off by listening, by assessing, and by being like, okay, so she already has a really good understanding of what her kids need. She's enrolled them in a triathlon that Baylor is sponsoring. She's trying to buy them healthy snacks. So what's the barrier here? Okay, the barrier is that the gas station is the closest place to get food. The barrier is that she works really hard. So she can't be at home when they get back from school with a prepared meal. So they're having to grab snacks, right? So it starts with that level of not assuming you know, like here's the textbook, here's what you need to be eating. Before you even start coming up with your messaging, before you even start developing your program and getting funding, go to the communities that you believe you will be serving. They are the experts in their lives. They know what the challenges are. They will help you do your job effectively. So there has to be collaboration. There has to be listening. You know, here at Stanford, when I do trainings for healthcare providers, mostly for physicians, about how to effectively communicate with patients and the public. And these are really busy, really important, and, you know, stressed out physicians. They come to my sessions like, okay, just tell me, what do I need to say? How do I need to communicate this? And I'm like, okay, put everything down, because to be an effective communicator, you have to shut up first. And I know we as doctors are really bad at that. You know, the data shows that on average, in a clinical consult, we will let patients speak for only 11 seconds on average before we interrupt. That's how bad we are at shutting up. But I think it goes, you know, beyond doctors, it goes to scientists and experts and people working in policy across different fields. You think you know a lot, and you do, we studied a lot, but the people who you're trying to be in service of, they are experts in their lives. And if you're trying to help them, don't go to them with the education first. Develop that education in collaboration with them so it's really meeting their needs.
That is really helpful, Seema. Thank you. One of the things that kept coming up in your writings that stood out to me was this term, trusted sources. So help us understand what you mean by trusted sources, and in follow-up, how can we develop trusted sources for our communities to be sure that they not only hear, but are more likely to act upon helpful health information?
Right. So again, this varies from community to community too, right? Because as soon as you asked that question, my mind went to, well, in my family back home in England, in our community, the imam is a very trusted source because my family is very religious and we're Muslim. So they'll come to me for advice about stuff, thankfully. But I'm the only physician in the family. So when it comes to vaccines, when it comes to rumors spreading that vaccines have some element of pork or pig product, which they do some years actually, if they're worried about getting the flu shot because it's going to be, you know, prohibited in our religion, they will listen to the imam. So then you need to make sure that the imam is adequately informed and has the right edicts to hand, that in Islam it says that even if there are pork products in a medicine, you can still take it. Doesn't make you a bad Muslim. It makes you a responsible Muslim who cares about public health because you went and got your flu shot. But that's going to vary from community to community, right? My family also brought up in a very patriarchal setting. So what the doctor tells them, they do listen to, what the doctor says rules, but that's different for different communities. So it comes back to that listening. However, this is a really tricky question to answer in this moment, Don, because one of our go-to answers, when we're not just thinking about a community level, but thinking about the public in general, where can you go for trusted advice? One of the things we would say is go to cdc.gov. And that's becoming really tricky right now because we're seeing how much political interference there is with the scientific process. We're learning from sources at CDC that they publish a report with these 10 guidelines about cruise ships and COVID, about older adults and COVID, and the White House scratches out 6 of them as an example. Yeah. So it makes, we've seen just so much more happen in the last few days and weeks. The CDC guidance that's on the website that is not scientific, and you're like, why are they even saying that? Then it disappears, then something else appears, then we're told there was an error. It's really, this issue of trust is not one that I have a neat answer for because it's really hard at the moment, but it brings me back to let's find stakeholders and trusted sources at the community level. Because actually even more than CDC, people will listen to that person in the community, whether it's a barber, whether it's the local pharmacist who works with Safeways. Mm-hmm. You need to find out who those folks are who are trusted on a community level. And, you're talking to me as a public health person, but when I think about public, it should really have an S at the end. And in academia, we do talk about publics, because otherwise you get this false impression that we are a monolith, that all Muslims are the same, or that all Black Americans have the same beliefs about health, or that all Oaklanders or all people in Berkeley, like, it doesn't work like that. As a public health person, you have to be really, really astute to the idea that we are not a monolith. And that works when you're looking at anti-vaccine groups too. You interview 10 people who don't want to get the flu shot this year. They might give you 5 different reasons amongst the 10. So therefore, you giving one message to all of them may not work when you need to craft 5 different messages. So for me, when it comes back to the trusted sources, in a nutshell, it's becoming harder to say, go to cdc.gov because we're seeing about the political interference, which is terrifying. But it brings me back to this idea that let's listen to communities, find out who they trust on a local level, and then work with those folks.
Wow. Well, that's very helpful, Seema. So you have had a lot of experience in communicating the importance of public health emergencies, like what we're going through now with COVID-19. Well, many of us and many listeners to you right now feel that food justice is a public health emergency. So based on your experience in other health emergencies, can you give us some guidelines as to how we might communicate that food justice is a public health emergency, as well as what other public health emergencies are?
Yeah, and I think that is a thing that we struggle with in public health. As I was saying to you earlier, Don, we're really trying to push this message that public health is more than infectious diseases, which becomes harder when you're in a pandemic. We have to remind people that public health is also gun violence and intimate partner violence, and public health is also these chronic non-communicable diseases like heart disease, like cancer, right? And I think we have to think about messaging in ways that are clever and innovative and remind people that nutrition is at the basis of absolutely everything, about how nutrition and gut health affects our mood, affects our likelihood of becoming sick with particular diseases. And I think one way of doing that innovatively is by telling people stories. And I know sometimes we do shy away from that as scientists because one story is one data point and it's anecdotal, and we like, to be able to show statistics. But I think it's a really powerful way of communicating a message, is to make it feel very real, to be like, here's a particular message we have about food justice, about how access to food transformed this family's life or this community's life. And let me tell you that particular story. Otherwise, we throw numbers at people, we throw lots of evidence at people, and it's not very emotional or compelling or memorable. So I think we have to go beyond facts to tell stories.
Can you give an example of a story that you have told in communicating the importance of a public health community that you thought was helpful?
Yeah, let me think. There's been quite a few. I think one recently, not that I did, but a couple of years ago, there was a really bad outbreak of TB in Marion, Alabama. So this isn't a food example. It kind of brings together everything that I've been saying. So really bad TB outbreak in Marion, Alabama. People at CDC and in public health agencies being really like, irate and confused. Why aren't these folks coming to get their TB testing? There's record high rates of TB. And I was like, if you just, I'm not even from the States, but if you look at Alabama on Google Maps, see where the TB outbreak is, it looks like it's about an hour or two drive from Tuskegee. Where we had one of the most unethical studies done by CDC and United States Public Health Service doctors. And to me, that reminded me of the way that we try to forget history and the way that we try to forget stories and just live in our world of facts. TB outbreak here, we're offering free TB testing. We're even offering cash incentives for you to start to get TB x-rays to check for TB. And you're like, you're missing the fact that there are people who live really close to this area who either lived through or have very recent memory of family and community being exploited through these unethical studies back in that ended in the 1970s. So for me, that was one way of like that disconnect of us trying to erase history, not atone for history, and really missing the mark on understanding why a community may not be forthcoming in wanting to get tested against this really deadly disease. So I think that's one example. I shared the link to that Dallas Morning News story I wrote 4 years ago, because that's another example of all the stats are in there about childhood obesity and diabetes. But I think unless you bring it home, literally, to South Dallas, to Fraser Courts, tell the story of that mother and her 2 kids and the grandmother and the aunt who all live together, then it's hard to kind of like visualize what do the statistics mean about risk of death from obesity, and what do the statistics mean about risk of death from diabetes. So I think you have to tell those stories.
Yeah, it's interesting, Seema. Thank you for that. It's interesting as I listen to your focus and our focus on South Dallas. I'm reminded some discussions that I've given with some of my physician colleagues when I talk about health in low income, particularly Black and brown communities. I've had a lot of my physician colleagues say, look, I practice in a highly resourced area, and I'm still dealing with issues of health and nutrition there. So I sometimes wonder whether or not the message that we want to communicate about the importance of food justice, particularly in the quality of food, needs to be a more general message. Certainly, there are times we want to tailor it to particular communities, but I wonder, what are your thoughts about this being a more general in addition to a tailored message?
So I would say general issue, but tailored message, because it is a general issue in that we all have similar bodies to some extent, and therefore nutrition affects us similarly, and it's very powerful in our lives and impacting our health and our life expectancy. So it's a general issue in that regard, but I still wouldn't want a general message around it, because I think the reason that somebody in Highland Park eats a particular way, or lives with obesity, or lives with type 2 diabetes and metabolic syndrome is different from what that family is going through in Fraser Courts. It's not because the only place to get a snack in Highland Park is a gas station, right? It's a very different like that. For that reason, I think that there can be a very humanizing, unifying message to this, that we're all affected, but then we're really affected unequally, and we're affected in different ways. And so I think those approaches, that messaging, that programming has to be very much according to the particular issues of that zip code or that census tract even.
Absolutely. So in our 3 previous conferences, Seema, we talked about what is food justice, what would food justice look like in Dallas, and post-pandemic rebuilding with more equitable food policies. Those are the kinds of messages that we want to get to our community and to have them act upon it. So I think the guidance that you've given us has been really, really helpful in articulating that message and hopefully getting them to move forward with it. So once we get them to move forward and to do what we would ask them to do, what do you think we would then say would be measures of success that we then can tout?
Metrics of success is something we're really obsessive about in public health.
Absolutely.
We never want to implement an intervention without knowing did it work? How are we going to measure it? And we think about this in journalism too. Even though I've been thinking about this, I haven't got a really neat answers. In a way, I'm going to cheat, but not cheat, because I think this is still the smart thing to do. I would throw it out to the community. I'd want to go back to Morgan Dupree and her brother in Fraser Courts and be like, if we're going to do this, at the end of it, how do you want to feel? How would you, what would we have to meet for you to give us a trophy to say that we succeeded, or to give your community a trophy? Throw it back to the communities, because it's also a way of understanding what success looks like to them, right? As opposed to me saying.
I like that.
And also because just when it comes to nutrition, I think some of our metrics are really off from a medical perspective. So BMI is really problematic. So you just throwing that out there as one example. So is it going to be that, I don't know, population level BMI drop, but BMI, like most athletes are like BMI obese if you look at it, right? So I just worry about existing metrics that we have not being fully up to this. I think we need to develop some metrics. And so it could actually be really fun and a mapping and futuristic exercise with the communities you want to serve, to be like, what does that look like? What's our vision of success? And when you've painted that picture together, that's really motivating, actually. It's not someone else saying, this is what we think it looks like. It's you helping to paint that picture and then actually being more motivated to get there. Can I throw the question back to you, though? Because are there things that I am missing when you think about, like, or just something really obvious when it comes to measuring success?
Seema, I'm just resonating in what you just said. That was really insightful. What is going to be successful to the individuals and the families that we serve? That, as I said, that's insightful because, like you, I often think about it in terms of the macro, that the level of hunger is reduced, that the amount of nutritious food that is being delivered to the community is improved. So I'm in my position thinking about it in terms of macro, but on the level of the individual families, I really like that. So we need to develop these metrics of success collaboratively with the folks that we're trying to help. I like that.
And with kids, I think. So I want to know, kids may not just speak about what it feels like to be hungry or not hungry, but the things that they can do when they're not feeling hungry all the time. So I think that can take us to a much more optimistic and positive place. I just think about those kids in Fraser Courts a lot still, and the fact that one of the issues there, you know, thinking so much about food and nutrition and diabetes rates, actually one of the issues that their mom was up against, it wasn't a safe place for them to exercise on the streets. So she could spend as much money as she wanted on little skateboards and scooters and bikes, you know, but where were they going to ride them? So I think we can sometimes miss those things if we're not having those conversations and not letting the kids tell us what success looks like. I think they need to be our bosses because they're really who we should be serving, the next generation.
Absolutely. So Seema, we've covered a lot of ground in the last 45 minutes, and you've really given us a lot to help direct our work. So I'd be remiss in the last minute that we have if I didn't ask you something that we didn't cover, something I didn't ask that you think we should know as we go forward to try to activate our community for food justice.
I think sometimes remembering why we all went into this field, because we are really, I'm a public health person, but all of you who are joining today, this isn't just a job for you. This is a vocation. It's something you really believe in. And I think sometimes when it feels like the rest of the world doesn't care or doesn't want to fund your project, that can really get to you. So just my advice as someone who gets demotivated as well, when you hear like someone really high up in the food chain talking about a cure for COVID and you're like, oh my gosh, like we have to undo so much of this now. I think it can be really helpful to wake up in the morning and remember why we do what we do and think about why we care so much, and even why we get upset so much is because we care, and really use that as our fuel. And I just say that because I'm really in admiration for all of the work that you do. I've been looking at people writing in the chat, you know, where they're joining us from, the kind of work that they're involved with. It really feels to me like groundbreaking, life-saving work, even if it doesn't always get framed that way. I think to me it really is. And so I wish you lots of power to continue doing this because it's going to be so important to our future and especially the future of young people. So thank you so much for having me, and I hope some of what I said was useful.
Oh, absolutely. Certainly it's been useful to the audience, but I have to speak personally. It's been very useful to me as an individual. So on behalf of the coalition, thank you for giving us this time. Thank you for giving us your the benefit of your expertise. And I think, Juanella, we're to the point now where we can address a few questions for Dr. Yasmin. Is that correct?
Yes, there have been a couple of questions that have come through in the chat, and I think she might be able to get to them quickly. Can you talk about the role of social media in disseminating health information or misinformation?
For sure. So I would start off by saying that the whole issue of false news, of misinformation and disinformation is not new. It's been around in the media since at least the 1890s, since the days of what we called yellow journalism. So it's not like it's a new problem that we're tackling now. It's not brand new, but it's a problem where the dissemination can be faster and the news can spread farther. However, I don't get totally, I've written op-eds and stuff in the New York Times. You can read about Facebook and how little they are doing to really dampen down the effects of health misinformation and disinformation. But I don't get completely depressed by it, because I think there's a lot of power in social media, and we have to be creative in using that power, in leveraging those platforms to get our messages across. So yes, a lot of falsehoods will spread on social media. Pinterest, is a big platform for anti-vaccine messaging. For example, just the other day, oh my goodness, I wish I'd thought of this earlier to bring it up, but there was a tweet from a physician on Twitter saying that, like, nutrition is what you put on your fork is more important than what pills you take. And the discussion that followed from that kind of went viral, from people saying, well, I take antidepressants, or I take antiretrovirals, or you said. And so these are actually really good engagement points for jumping into a conversation and having that conversation and doing some education around it. So I would just make sure that we don't get completely put off by how frustrating social media can be, and we think about creative ways to tap into and leverage those platforms as well. Because people do a lot of their learning via Twitter, Instagram, Facebook, Pinterest, TikTok, wherever you may think of them doing their learning via those platforms. That's the real world. It's where people are getting information. So we should be on there sharing our messages too.
And do you have time for one more question?
Of course.
Can you speak to the increasing role of healthcare systems in developing community nutrition outreach programs and community health outreach programs?
For me, it comes down to what level of collaboration there is. I made this point earlier because I worry that we keep repeating our mistakes in medicine and in health and science broadly, being an institution, being the experts, and doing that trickle down thing where we go into a community already with a program set out and are like, now we're looking for collaborators to roll out the program. And then sometimes we struggle, it doesn't always go as well, because we should have started that collaboration 10 steps ago. We shouldn't assume that just because we are the health system that serves that community, that we always know exactly what that community needs when it comes to nutrition, for example. So I wish that, and maybe this is happening more than I realize, but I don't think it's happening enough, is that we start the collaboration way earlier. We don't assume that we are the only experts. We remember that the experts of the community reside in the community. They are the community members. Bring those imams, those pastors, those mothers, even those kids onto our planning committees early on. And I think, honestly, that will make us more successful overall.
Thank you. Thank you. That's all, I think.
Thank you so much for having me.
Thank you, Seema, and all the best to you as you keep going forward.
Thank you so much. Take care, everybody. Bye.
Bye-bye. So Grace, good to see you on the Zoom, and it looks like we're going to turn this over to you. So thank you.
Yep, thank you, Dr. Wesson. All right, so if you attended all 4 of the webinars in our food justice series so far, then you'll know that there have been a lot of really important takeaways and powerful insights from our distinguished speakers and panelists. So a few of the things that come to mind for me, from the first event with Maliki Kenny, he explained what food justice is and how the problem of hunger is a problem of social inequities. He explained how fighting for food justice means fighting not just for food, but fighting also to dismantle white supremacy. And to fight for food justice, we must work closely with affected communities and help elevate their voices and their solutions versus coming in and imposing our own. Then in the next session, we explored what food justice could look like in Dallas. We heard the perspectives of 4 amazing panelists on what's happening in Dallas today, like home and community gardens and other efforts in place to help communities become more self-sufficient in terms of food. And we also heard about what we need to see more of in Dallas. For example, more permissive policies that will remove barriers to communities becoming self-sufficient for things like farmers markets. Then in the third event last week, we learned about food policies, and especially in the context of the pandemic. We learned about the HEROES Acts and other packages that have been passed to expand SNAP and support people and families who've been affected by the COVID pandemic, and specifically whose access to food has been affected by the COVID pandemic. We also learned how SNAP is recognized, even by conservative economists, as one of the most powerful ways to provide food for families and also stimulate economic activity in local areas. So on that note, it's very important for us to support SNAP and other such policies through our vote. And in case you missed any of our webinars and want to learn more about what happened in them, I highly encourage you to check out the Dallas Coalition for Hunger Solutions on YouTube. DCHS has uploaded some recordings of these sessions, and we'll upload a recording of this one as well for you to watch. And now, activating Dallas for food justice, we're turning to today and what we're going to do going forward. So now it's your turn to speak. We want to hear your thoughts, understandings, and ideas on how the Dallas area communities can create a more just food environment and improve community health. When you registered for today's event, you selected your areas of interest. We have pre-assigned you in some breakout rooms in an effort to achieve a cross-section of interest in organizations, experience, and expertise among the participants in the room. Shortly, you'll be routed to your pre-assigned breakouts where you can quickly introduce yourselves to each other. Then a facilitator will guide you through a discussion of these questions for the next 30 minutes. Those questions are, where are we today? So reflecting on where we stand now in terms of food justice, then where do we want to go and how will we get there? And then what part will you as an individual play? What commitments will you make in the short term and in the long term as well to fight for food justice in your community? Then after about half of an hour, you'll be automatically returned to the main meeting for the gift card drawing, very exciting, and some final remarks. In terms of the gift card drawing, participants who've attended all 4 webinars in our series and returned from the breakouts today are eligible for the drawing. So I hope to see you all come back after our discussions that we have soon. Facilitators, please do take notes. Our team will reach out to you next week to collect your group's feedback and ideas. And soon we'll send out a report to everyone of the general themes that emerge from your discussions and next steps, and hope to continue that conversation and other avenues going forward. Everyone, please accept our apologies in advance for any glitches